Hello, and thank you for joining the podcast Emergency Minute. Your host is an emergency medicine physician who brings over 20 years of experience in healthcare. Dr. Parente will take you through some of the trending topics and challenges faced in the ER and all of healthcare. Join in the fight against misinformation, and don't forget to follow on social media at Dr. J. Parente. Now, here's your host, Dr. John Parente.
All right, welcome back, everyone. How are y'all feeling? Thanks for joining us this week for another episode of Emergency Minute. Can't wait to talk to you guys about episode 7, sudden cardiac death in athletes. But before we get started, I wanted to thank each and every one of you out there for listening, commenting, sharing, reviewing. Much love to each of you. This show is definitely for you. Lastly, I do have some podcasts now available on YouTube, so be sure to check them out at Dr. J. Parente, and please don't forget to click subscribe. All right, obviously the catalyst for this podcast idea was brought on by the near tragedy of Damar Hamlin and what happened on national TV with the Buffalo Bills when he collapsed. Today I'm going to discuss some things that could cause an athlete to collapse on the field, and we're going to take a closer look at Damar's situation. I'm also going to discuss things that you can do if you have children or you have loved ones that are playing sports. What can you do to minimize the chances of something like this, although unlikely, something like this to occur? So before we get started, I wanted to take a moment and commend all of those that were involved in taking care of Damar, especially on the field. So I don't have any inside knowledge of who is on the sidelines, their respective levels of training, but I can tell you what they did, nothing short of heroic. You see, in the hospital, if somebody rests right there in front of us, it's a bit of a controlled environment, right? Like we have the ability to control some things that will impact somebody's care. The patient's likely hooked up to a monitor, meaning we can recognize this faster, treat them faster, respond quicker, and improve their chance of survival. Patient probably has an IV, or at least if they don't, we can get one quickly to administer life-saving medications such as epinephrine. We do have multiple people in the room that can kind of help us as well. So being in the hospital, there's obviously an advantage for this. But what about being on a football field? I mean, first and foremost, you aren't exactly expecting somebody on the football field to just collapse and have this devastating cardiac condition right in front of you. That's not like high up on your mind. You're probably thinking more like, let's look for injuries. Let's look for broken bones, cuts, scrapes, obviously things like concussions. You're not exactly approaching every situation like it could be cardiac arrest. But even so, a well-trained emergency medicine, physician should be able to recognize full arrest fairly quickly and easily. That's kind of the easy part. Then you have the harder part. What's that? Well, you have an NFL player in a full uniform right in front of you. Like the obstacles in order to treat him, much less diagnose him, very difficult. So we have to take the helmet off to even approach the airway and talk about intubation, which is putting a tube down their throat and breathing for them, getting the oxygen to where it needs to be. And then, oh, by the way, you have an NFL player wearing shoulder pads and a jersey. So you'd have to have trauma shears handy, cut off the jersey. Okay. Then you'd have to probably cut through the shoulder pads. Anyone who's ever had a kid play football or played football themselves, like those things are a nightmare to take off. Not to mention all the other pads and wraps and everything else to expose the chest. So why do we need the chest exposed? Well, we need to be able to see, listen, feel. Do we have any heart sounds? Are there any lung sounds? Probably not at that time, but then you have to do CPR, right? So, and then the other things to think about, like obstacles to getting an IV, does the player have tapes and wraps and things on his arms, and his arms are super sweaty because he was just playing in a football game? Like getting an IV is probably extremely difficult there. So then you start to think, okay, how far away is the AED? Is someone like running to grab that? Obviously, it's going to be on the field somewhere because that's critical. And I know the NFL mandates that, and going back to the IV, he may have had an IO, which is an intraosseous line, which is basically where we drill in either to your humerus or your tibia typically, and give you an IV that's like, takes 2 seconds. So these are some things to think about that like really are astonishing when you think about that he actually survived this event. So the odds of somebody surviving what is termed OHCA, out of hospital cardiac arrest, is about 10%. The odds of someone walking out of the hospital without disability with that cardiac arrest is 8%. So for Damar to be with us today is truly a testament to everyone that played a role in his care, and I commend them for this. Lastly, I wanted to clear something up. I did put out a tweet and tag the NFL and implored them to consider having a board-certified emergency medicine physician on the sideline for every NFL game. And the tweet kind of went bananas. From what I read, the NFL didn't always have an EM physician on the sidelines, but I think I was wrong. And what I've learned is that they actually do. And the ER physician is wearing a red hat so that they can be easily identified, which is kind of cool. But part of the other reason the tweet went bananas is I had a lot of people from other medical trainings and backgrounds kind of come at me and be like, hey, we're just as qualified, if not more qualified, to take care of this patient than you. So that was part of the other reason why this happened. And I wanted to set the record straight that by no means was my tweet meant to be demeaning towards nurses, medics, trainers, family physicians, sports medicine docs, anything like that. I simply believed it would be a good idea to have an EM trained physician on the sidelines for these games. And by the way, it turns out I was right. The NFL agreed with me, so you're welcome. Moving on. So immediately after this, I did go to Twitter to see if I could get some sort of information about what happened. And I did learn something that was very helpful. Everyone on Twitter is a physician. So if you guys didn't know that, you do now. You're welcome. But the immediate response was that, oh, this must be a head injury, right? He's showing signs of concussion. This must be concussion. Well, if you haven't listened to my podcast, episode 6, Concussions, highly recommend you do so as soon as you're done listening to this one. Selfish plug. Moving on. So could a head injury have caused the symptoms that were displayed that night? We're going to talk about that, but we're also going to talk about cardiac reasons why athletes collapse on the field or on the basketball court or whatever court they're playing on in more detail. So what are some things that could make an athlete collapse? The focus of this podcast will be on the cardiac causes because that's most likely what would lead to cardiac arrest and ultimately death. But let's talk about some other causes. In order to do this, you would really need to sort of organize this and compartmentalize. So you have to put these sort of diagnoses into different groups. So the initial Twitter doctors, which is everyone, they were all concerned about head injury, especially in light of the fact of some very recent high profile severe concussions that we've seen in the NFL. The only way this could occur is if someone got hit so hard that they were knocked unconscious. But that wouldn't explain the CPR on the field that DeMar underwent. And furthermore, if you got hit that hard, it would be unlikely that you could take a few steps like he did and then collapse seconds later. Now, there is something called an epidural hematoma, which is where you have bleeding inside the brain. Usually it's from impact onto the side, which is called the parietal side or temporal side. And that's where you get hit hard. There's internal bleeding. You have what's called a lucid interval, which means you're awake, you're alert, you're okay until you're not. And then you collapse. But that wouldn't explain, you wouldn't have cardiac arrest with that. So kind of a close cousin to head injury would be severe cervical spine injury. Could this cause collapse? Well, it would be unlikely, but it is possible. So the only real possibility here would be a severe fracture to one of the vertebral bodies, and it would have to be higher than C3. So it'd have to be like C1, 2, or 3. And it would have to injure your spinal cord bad enough at that level that would cause you to collapse. And you would have an associated what's called hematoma, which is a collection of blood, theoretically pushing on the nerves and such, one of the nerves being the phrenic nerve, which is the thing that makes you breathe. That would paralyze your diaphragm, lead to respiratory arrest, which ultimately could lead to cardiac arrest. However, that part wouldn't really make sense in DeMar's case because this process would take several minutes. If you took a young, healthy, or presumably healthy athlete and you made them stop breathing, they really probably wouldn't arrest for at least like 4 to 6 minutes. Your body has like some reserve, so this is not the ticket either. Now, there are some metabolic things that can cause a healthy athlete to go to ground, such as hypoglycemia or low blood sugar, but this wouldn't lead to cardiac arrest unless the glucose was like crazy low and it was for like a longer period of time, and then yes, that could lead to arrest. That would be highly unlikely because just like the play before, he like ran down the football field for the kickoff, so I don't think this was low blood sugar. How about seizures? Now, seizures can drop someone to the ground, but again, that wouldn't cause cardiac arrest unless you were seizing for so long that you actually stopped breathing and then the breathing led to cardiac arrest. So again, that's not what happened with DeMar. So what about environmental causes? Sure, heat stroke can drop someone to the ground, but not cardiac arrest, or at least not right away. And by the way, docs and nurses and mid-levels out there, don't be fooled by weather outside and turn on those blinders and miss something. I once had a patient that had a heat stroke in 35-degree weather. He was actually running a leg of a race and was the highest temperature I've ever seen in my career at 107.4 degrees. Turns out after the fact that it was actually from Theraflu that caused the elevated temperature before running the race, but moving on. Okay, how about anaphylaxis? So maybe he had like a really nasty seafood allergy and he ate like a big plate of shrimp before suiting up versus the Bengals and went into anaphylaxis on the field. I suppose it's possible, but cardiac arrest, it wouldn't be that sudden. And don't get me wrong, anaphylaxis is nasty. and escalates extremely quickly. If you don't get treatment ASAP, you will arrest if you truly have anaphylaxis. The bad news is everyone says they have anaphylaxis and very rarely do they, and that's a good thing. I don't encourage people to call 911 very often because it's overutilized in today's society and you wouldn't believe the things that we see in the emergency room. But this is one of those scenarios that I would highly recommend if you think you have anaphylaxis, call 911 because you're either going to have cardiac arrest or you're going to be treated with epinephrine by a medic. So how about a respiratory cause? Well, the only one that could do this is something called tension pneumothorax. This is where your lung collapses and puts pressure on the inner structures of your chest, your heart, which you kind of need, causing severe respiratory distress, severe pain, it drops your blood pressure, and then ultimately you will arrest if someone doesn't stab you or at least poke a hole in you. Anyone seen the movie Three Kings? That scene is absolutely gold, where George Clooney is putting a needle into the chest of Mark Wahlberg while Ice Cube's horrified, watching. And then Mark Wahlberg proceeds to run around and keeps evacuating the air out of his valve. It's fantastic. Kudos to the director for actually making this moment comedic. I mean, that's impressive. And then also kudos to the director for making the procedure relatively realistic. So many times in these movies, they do the dumbest, most inaccurate, horrible medical things in situations. Look, I got news for you. These budgets that these guys work with out in Hollywood are multi-million-dollar budgets. Give me $100. For $100, I will gladly talk to the directors, give them the input that they need so I don't have to cringe watching some product on the big screen where there's a person with a Foley catheter hanging out of their nose or they're intubated with a Yankauer suction catheter. Come on. I'll take the $100. Boy, did I get off track. But in reality, as nasty as a tension pneumothorax is, it would not cause cardiac arrest that quickly in his case. So that takes us down to the most common and most likely category, which are the cardiac causes. So these are the most likely. The first one that comes to mind is a player that has many names. So we're going to call it HOCM, but it goes by hypertrophic obstructive cardiomyopathy, amongst other names. There's HCM, hypertrophic cardiomyopathy, there's HOCM or HOCM, and then there's idiopathic hypertrophic subaortic stenosis, amongst other names. Why does it have so many names? I don't know. So what is HOCM? We're going to call it HOCM for the sake of this podcast. So HOCM is a genetic condition that causes hypertrophy, which is like a thickening of the cardiac septum, aka the wall that's inside your heart. Ultimately, this sort of happens without the patient knowing, and then this leads to an obstruction. And typically the first symptom of this said obstruction is death. So how's that for pissing in your Cheerios and this morning and making your day? So according to the literature, the incidence is 1 in 500, which seems extremely high. I don't think that's accurate, but there are fewer than 100 deaths per year, which means that if you're a young athlete, your incidence of death would be 1 in 220,000. So these do typically occur in that second or third decade, but can go all the way out to the sixth decade as well. Now, is this something that is preventable or something that can be caught? This is why it's important to go see your family doctor, especially if your child or young adult is having episodes of passing out or nearly passing out, what we call syncope or near syncope. Your family doctor will listen for murmurs, ask about family history of HOCM, other causes of sudden cardiac death. There is some testing available for genetic testing, but this is really only recommended for those with family history or if they're having symptoms that are unexplained, such as syncope. Most of these workups, like history, physical, labs, EKG, chest x-ray, all of these things are likely to be normal. Now, if you truly have a suspicion that this could be HOCM, you have to do an echo, which is an ultrasound on your heart, and that's about 80% accurate at detecting the diagnosis. And if you're still concerned, the gold standard is what's called a cardiac MRI, and that will then establish the diagnosis. Quick story, a few years ago, I was having some palpitations, and I saw the cardiologist while I was at work. I'm not even sure my mom knows this story, so we're going to find out very quickly if she listens to this podcast. So I get this EKG, and these palpitations are basically just PVCs, what's called premature ventricular contractions. Usually not a big deal, usually very normal, but in some instances, if they become more frequent or if you start having symptoms, you probably should be investigating them. So as a physician, I'm like, you know what? These are more frequent. I'm having symptoms. I should definitely have this investigated. So the next step for me was then a Holter monitor, essentially wearing an EKG on your chest for a 24-hour period. So I meet with the cardiologist. I'll never forget what he said to me. And he was from Syria. It was fantastic. And he's just like, well, John, some of the palpitations look like non-sustained VTAC. Now, non-sustained VTAC to my non-medical people, it is the thing that happens right before VTAC. And then VTAC is the thing that happens right before VFib. And then VFib is the last thing anyone sees before you go to Jesus. So this was kind of shocking to hear this. So he's like, okay, I'm going to send you to an EP specialist, and that's electrophysiology cardiologist, which is basically someone that studied for like 1,000 years on the electricity systems of the heart. I told him, I said, I have this upcoming vacation at Turks and Caicos. Like, I'm kind of nervous about this. Like, leaving the country, I had a lot of questions and concerns. I'm like, we got to get some answers here, before I leave. I'll never forget the thing that he said to me. What he said? He said, "I'll just take a life vest with you and just wear it." Like, okay. So I'm like, are you kidding me? So I'm like, walking around the beach, got my stylish life vest on. I'm crushing my fourth margarita by 11 a.m. only to be this like unpleasant surprise of my heart going into VTAC, getting this crushing blow from my life vest that may or may not save my life. Like, I was blown away. To this day, I'm not sure if he was just messing with me or if he was being serious. I think he was messing with me just to try to like make me feel better. But long story short, I saw the specialist. I had the Holter monitor, the EKGs, the blood work, the echo, and I did have the gold standard cardiac MRI. I saw the specialist again. I'm standing across the room from this guy who's like triple boarded, has more education than like the entire world. And he looks at me and he goes, "Well, everything looks good. Your palpitations don't appear to be dangerous. Your heart structure, your heart function looks good. Basically, just cut back on stress, alcohol, and caffeine." I'm like, wait a minute, hold on. I think I'd rather wear the life vest than do that. But I digress. In all seriousness, it was a pretty scary time for me. I never told my family because I didn't want to make them worry, especially because there was, evidently nothing to worry about. And after, $20,000 in workups and a few weeks of tests, everything came back normal. So, I was obviously gave me a new appreciation for people that are having cardiac issues and palpitations and that kind of stuff. And, what they're going through and what that workup looks like. So let's get back on track. So who are some famous people who have died from hokum? The two that come to mind for me are Reggie Lewis and Hank Gathers. And hokum is the leading cause of sudden cardiac death in young athletes. So could hokum have caused the collapse and near death of Damar Hamlin? Absolutely. In fact, it's statistically the most likely reason. So what would be the treatment for hokum? Well, first and foremost, you have to stop all strenuous physical activity. There are some medications out there that help manage the symptoms and kind of slow the progression of the disease, but make no mistake, this is a progressive disease. It will get worse. Eventually, you will have symptoms. And if you're having symptoms and you're doing all the right things and you're taking the medications, that's when you start to look at some kind of aggressive surgical options like a myomectomy, which is like a fancy medical term for shaving off some of that like thick extra tissue in the heart that undergo that hypertrophy. And then, of course, there's heart transplant, which is less than 6% of hokum patients, but that's obviously pretty aggressive. So another cardiac, or I guess more vascular cause of sudden cardiac death would be PE, or pulmonary embolism, which is a blood clot to the lungs. Now, 95% of blood clots originate in the leg, they bust loose, they travel to the lungs, and then that's when they wreak havoc. So in most instances, patients will experience some chest pain, some shortness of breath, maybe they're passing out. But in some cases, and this is less common, a patient can experience sudden cardiac death if they have a massive PE or a saddle PE. So how does this occur? Well, essentially a clot is like a cork that blocks the pulmonary vessels. The right side of the heart then works hard to get the cork out unsuccessfully. And then ultimately this leads to blood that is not able to get into the heart, and that's called your preload, which leads to cardiac collapse and arrest. So would this be a possibility for Damar? Absolutely. Definitely on the differential diagnosis. It's reported that up to 10% of pre-hospital arrests can be from massive PE, but this is also thought to be an underestimate because it's very difficult to prove this. Most of the patients that come in cardiac arrest are elderly and don't get autopsies. And spoiler alert, like you only get an autopsy if someone suspects that there's been foul play or if the family requests it. And by the way, if they request it, they got to pay for it. So a lot of people end up not getting the autopsies, but obviously in a young, healthy person, that's definitely something that you would consider. Now, there are many other causes of sudden cardiac death that are less common that we're not really going to talk much about. There's heart attacks, cardiac artery aneurysm, numerous types of dysrhythmias, Brugada syndrome is another hot button word, amongst others. And, there may be another time that I do a podcast on some of that, but let's focus on the more likely causes. So what would be the second most common cause of death statistically in Damar's case? Commotio cordis. The enigma, commotio cordis, which is Latin for being a Browns fan and having your heart agitated every Sunday. Just kidding. So it actually means agitation of the heart. So this disease entity is fascinating to so many people because it's so strange and thankfully so rare. This is a cardiac arrest that is caused by blunt trauma to the chest that leads to VFib and eventually asystole, which is where the heart stops. Now, this is so strange of a diagnosis and disease process that is really not that well understood. But the one thing that's kind of bizarre about this is that there's nothing wrong with the heart. The heart is structurally normal. So the object hits the heart just at the right moment of the electrical impulse that causes basically like a short circuit, causing the arrest. It's like the heart is stunned, for lack of a better term. Thankfully, this is very rare. Less than 30 cases are reported annually. The mean age for this in the United States is 15. It's very rare past the age of 20. Now, the other thing that's interesting about this is it's 95% in boys. But is that just a bias because boys are more likely to be in sports that cause impact into the chest, like in baseball or football? I don't know. There's still a lot of unknown about this disease, and there's a lot of contention that sort of surrounds what causes this. But there are some things that we do know. First, we know that the impact has to be anterior chest right over the heart. We know this. Okay. Secondly, there has to be force that's significant enough, but not too significant. Well, what does that mean? It means it has to be hard enough to cause a cardiac rhythm disruption, but not so hard that it would cause cardiac contusion. So they estimate roughly 50 joules of energy that would be able to cause this. So like if you're in a car crash and like the steering wheel comes like launching into your chest, that's going to be a lot more than 50 joules, but that's more likely to cause cardiac contusion and some other things. So honestly, like 50 joules is like a baseball that hits you just right in the chest, or like a punch that just hits at the exact right time. Or is it a shoulder that goes into an NFL player's chest at just the right moment, at just the right energy? Perhaps. And that's what makes this very fascinating. So is there anything that can be done to prevent this freak occurrence? Well, how about chest protectors? Do they work? We've seen soccer moms and dads all over the country buying up these chest protectors for their kids playing baseball. Unfortunately, they don't work. A retrospective study looked at the data. Chest protectors have not been shown to reduce this. In the analysis, 37% of the cases of commotio cordis had chest protectors on. So they don't work. So what does the AHA say? What does the American Heart Association say? Well, I'm going to paraphrase, summarize, and I'm going to give you what they say. They say three things. Number one, make sure people are aware of this diagnosis. Number two, use softer balls if possible. And number three, try to avoid getting hit in the chest repetitively. The fact that these are like the actual recommendations from the AHA tells you exactly how little we know about this actual disease entity. So what about an elective echocardiogram? We said earlier it's about 80% accurate for diagnosis of HOCM. What about commotio cordis? See, there's the problem. Commotio cordis has a completely normal structural heart. Everything's fine. So no point in getting that echo in that situation. So if your kids are in sports, like what kind of things can you do to sort of give them the best chance of survival in the unlikely event that something like this did happen? I mean, besides using softer balls. And by the way, I don't think anyone could fault parents out there for buying up chest protectors. Like, look, my kids wore them when they were playing baseball. And, I don't blame anyone. I'm not ashamed to say that either. But I think the biggest two things you can do is number one, be aware. And number two, ask about AEDs. Automatic external defibrillators. Most like gyms and schools and things like that have these by now, but there's probably like some fields and things that probably, they don't have it. So I think it's okay to ask that and see if that's something that your school or your team could kind of look at. Now, if you really want to look like a badass and at the same time potentially save someone's life, if you do see someone collapse and like someone's like running for the AED, because that's like step one is go get the AED. And obviously you got somebody else calling 911. But if you're like there and you're like, I don't know what else to do, you reach up with your fist and with all of your might, you just absolutely wallop them in the chest. Now, I know you guys think I'm messing with you, but this is an actual technique. It's called a precordial thump. I've done this a few times in my career. When a patient codes and arrests right in front of me and we don't have like the pads hooked up or anything like that, there's nothing more hilarious and gratifying than absolutely walloping a patient who's basically dead, nailing them in the chest, and then they sit right up and look around in confusion, and you look like a hero. And I once did this to a patient that arrested in front of me, and I just walloped him, and like in one motion, he like sits up, stares around the room, and he's like, why the hell did you do that? And I could do nothing but laugh and explain to him what had just happened. So ultimately, what happened to Damar Hamlin? Well, he won't tell us. And just an FYI, he doesn't have to. It's frustrating. The general public gets pulled into this when very tragic things happen to celebrities, much less when someone's undergoing CPR on national TV. So we all want to know, and rightfully so. Of course we want to know. We want to know, was it commotio cordis? We want to know, was this massive PE? Does he have HOCM? What are the things that could be causing this? What happened? But guess what? It's his healthcare. It's his right to know and to keep it to himself. Quite frankly, I'm surprised it didn't get out somehow. And so as frustrating as it may be, that's the reality. So statistically, and that's all I'm talking about, I don't have any inside knowledge as to like what actually happened. Statistically, the most likely cause is actually hokum. And this would end his career in football and all other sports. Now, the second most likely cause, if you just look at the data, is commotio cordis. Now, there's a study that looked back at causes of sudden cardiac deaths. They looked all the way back to 2003 for like young athletes. And they came up with 26% of the deaths due to hokum. And it was actually closer to 33% once they sort of added in a few numbers from a different type of hokum. So about 33% hokum, about 20% commotio cordis. So those are pretty high numbers. Those are your likely number one and number two. However, that still means there's about a 47% chance that it's something else, which is pretty darn high. So some of the other causes that we discussed today, certainly in play. The real question is, if he did have commotio cordis, is he going to continue his NFL career? Can lightning really strike twice in the same spot? Tough to say what I would do in that situation. The medical recommendation for these players and these young athletes, if it is commotio cordis, is that they are able to return to the field, which is, I don't know, that's a hard thing to wrap your head around. So I don't know what I would do in that situation, but this is all very fascinating nonetheless. Nonetheless, I'm very happy that he survived. So thank you for joining me this week for the episode of Emergency Minute, Sudden Cardiac Death in Athletes. If you like what you've been listening to, please consider sharing this with someone that you know. Sharing on social media, especially when I release that I have a new podcast available, is really helpful to me as far as getting this out there and this information out there. Remember, you can follow me on any social media platform at Dr. J. Parente. Join us next week. Really exciting show. I'm going to start talking about medical myths that just won't die. Please help me kill them and bury them forever. Make them go away because they haunt me. You're not going to want to miss this. And as always, peace, love, and happiness to everyone out there. Cheers, everyone.
Thanks for joining us this week on Emergency Minute. Join us next time for more hard-hitting discussions on some of today's issues in healthcare. Don't forget to leave us a review on Spotify or follow on social media at Dr. J. Parente.